Hello, my name is Suzanne Ranta. This is the Facility Compliance Board meeting, HCA 322, Healthcare Ethics and Medical Law. As the Compliance Director, tonight I will be providing you with an overview of the hospital's compliance programs as it relates to the moral rights to healthcare. It is our goal to provide quality care to all patients who present at our hospital, regardless of their ability to pay. EMTALA laws clearly delineate healthcare provider responsibilities, and our facility adheres to all laws and regulations. I will explain to you tonight how our facility not only meets all compliance standards, but exceeds them specifically as they pertain to confidentiality, HIPAA, ethics, patient rights, and cultural competency. Compliance in healthcare is a complex situation as lawmakers continue to create bills. Let's start with HIPAA. HIPAA compliance. HIPAA is an act which mandates that all providers of healthcare implement policies and procedures in order to ensure that patients' rights are protected and their medical records are kept confidential. Regardless of whether a facility has paper, charts, electronic, regardless of whether information is being transmitted via fax or email, providers must have a patient's consent to share information. If the patient is not able to provide consent, a family member or court-appointed advocate will be able to direct providers as to whom they can share information with. The Health Insurance Portability Act of 1996 forces us to adhere to the law and implement mechanisms to keep all patient information confidential. We here at the facility have taken additional approaches in developing training programs which are quite interactive between our physicians and staff. This creates and maintains a culture within our facility with focus on including all staff, which respects patients' privacy. Our ethics and conduct policies. Ethics is extremely important to our facility. As our mission and value statements notes, above all else, we are committed to the care and improvement of human life. We continue to strive to deliver high-quality, cost-effective care to all patients who present at our facility. Setting aside laws and regulations, as a healthcare provider, we have a moral obligation to act appropriately and with integrity. We recognize and affirm the unique and intrinsic worth of each individual we interact with, including our patients, our employees, physicians, third-party payers, and vendors alike. We act with absolute honesty and integrity and fairness in the way we conduct our business and the way we conduct our lives. Our code of conduct provides guidance to all colleagues and helps us carry out our daily activities within appropriate ethical and legal standards. Each employee is mandated to take ethics training annually, including physicians. Patients' rights. With regard to patients' rights, we make no distinction in the availability of services, admissions, transfers, or discharge of patients, or the care we offer and provide based on age, gender, disability, color, race, sex, sexual orientation, or national origin. Patient autonomy usually takes form by the way of informed consent. Adequate disclosure of information, the patient's ability to make decisions, the patient's comprehension of the information, freedom from any coercion, and lastly, the consent of the patient. The Affordable Care Act mandates a set of patient rights. This bill focuses on protecting patients from unprincipled health insurers. However, it also notes many ethical and legal aspects of healthcare. At our facility, we post the Patient's Bill of Rights at all outpatient centers and in each department. We post it in several different languages so each patient can understand, interpret exactly what their rights are at our facility and within our state. Cultural competency. Culture is clearly a priority for our facility. It is one of the most fundamental factors in each and every clinical encounter. It is essential to the appropriate diagnosis and to the treatment plan. It is a central focus point in caring for patients as it could be a major element of a patient's health beliefs, their values, and perceptions. Cultural competence endorses the principles of healthcare ethics. They go hand in hand. We practice total respect for patient autonomy and justice. Our facility offers cultural competence training, which is mandatory for all staff and physicians. We exceed the federal and regulatory guidelines in all our compliance programs. Additionally, our training efforts and compliance will most likely help to decrease medical malpractice claims. Know that our focus is in having a moral commitment to a culturally responsive, patient-centered environment. In this regard, we not only meet the standards of the laws, but we are totally aligned with the practice of good medicine. Our cultural guidelines are posted on our website and again within each unit of the hospital. I hope that I was able to share with you our programs in detail. If you have any questions, please feel free to ask. I welcome everyone's input. Thank you.